Can you talk about this growing issue of hypothyroidism? I know I've had several friends who have been diagnosed, and it seems to be more common now than it ever was before.
It is.
Okay.
It's an epidemic.
Let's talk about hypothyroidism as an epidemic. Why is it affecting so many people across America?
Well, you go back and look at the epidemiology of how this stuff developed in the first place. Hypothyroidism has been around for centuries, but it became more apparent and more affected more people with the advent of antibiotics.
Okay.
This was, many years ago. The first people to die off in the plague or any type of disease spreading were the hypothyroid patients because their immune systems are shot. They always get sick. They're the first ones to die. So the ravages of disease was killing them off. Then we invented antibiotics, started keeping everybody alive who had kids who were hypothyroid and so on and so forth. So now we have this huge population of hypothyroid patients. And we order the wrong test, so we always miss it. We're missing 5 out of 6 of these people because we order the wrong test.
Let's talk about those tests with hypothyroidism. If I go into my general practitioner, is he giving me the right test?
No.
Is she going to find out what's wrong with me?
I shouldn't say no. That general practitioner may be ordering the right test, but if they go according to their training that they got in medical school and their residency training programs, no, they're not getting the right test. They're ordering the typical thyroid profile of a free T4, a T3 uptake, and the TSH. The TSH is considered the gold standard, and it is not a very good test. It doesn't test the main hormone, that's T3. And you need to get the free portion of the T3 to really get the most accurate test.
So, Dr. Knott, if I'm a patient and concerned that I could have hypothyroidism, what are some of the symptoms that I need to be looking for?
Fatigue is really the biggest symptom. Weight gain, hair loss, brittle nails, hypertension, high cholesterol, constipation, depression, infertility. The list is huge. And what we do, though, is instead of identifying properly hypothyroidism, we treat the symptoms. And that doesn't solve the problem.
Rather than getting to the source or the root of where the problem is.
Yeah, treating the hypothyroidism, absolutely.
Another question I have is, does a patient have to have multiple symptoms on this list, or could it just be one thing?
Well, usually one thing is explained by something else, but if a patient has three or more symptoms, usually you can just about guess they're low thyroid, yes.
So, Dr. Knott, we've been talking about hypothyroidism and the fact that it's really underdiagnosed and really mistreated. Why is that?
Well, there's 3 problems, and it all goes back to our training, like we were talking about before. Number 1, we order the wrong tests. If we don't order the right test, how are we going to make the diagnosis? And that's why we're missing it 5 out of 6 times. But even if a doctor orders the right test, the lab ranges are incorrect as far as being normal. As you can see here, the normal range for most labs is 230 to 420 on the free T3. Look at the optimal range. It's 400 to 500. So if someone comes in with a free T3 of 300, the doctor's going to say, oh, you're fine, you're normal. They're not normal. They're low. But therein comes the third problem. If they find that they are low and they actually are going to treat them that 1 out of 6 times, they give them the wrong thing. They give them a synthetic T4 instead of giving them the best medication, best hormone that is, and that's the desiccated thyroid. This is what it looks like.
And this is not a drug.
No, this is not a drug. This is a hormone. This is from a porcine source. It's a dried thyroid. It's exactly the same thyroid that your body produces.
Okay. Tell me a little bit about these bioidenticals and explain to me what that is.
Well, that's a new buzzword. It just identifies the molecular structure of the thyroid, or of any hormone, actually. A bioidentical hormone has exactly the same molecular structure as those produced by your body.
And so why are so many patients, as a good friend of mine was, just given Synthroid?
Well, that's a good question. And that comes from a marketing campaign put on by the drug company that actually manufactured Synthroid.
Okay.
And they dispersed all this information that was incorrect And the main product they talked badly against was this right here. They said it had quality control issues and it was no good, and use our product, it's perfect every time, and blah, 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 blah. So they gained a big market share. So they got the market share because of marketing, not science. This is the best product. Synthroid is not as good a product as that.
And you see the results of this in your patients.
Oh, I do. And even the endocrinology specialty itself now is recognizing the fact that people that are put on Synthroid should also be given some T3. And this is a combination of T4 and T3.
Okay, so you've got to be able to ask the right questions. So if
You
I
do.
go into my doctor's office and I feel like I've got these symptoms of hypothyroidism, I feel like maybe that's it, what are the questions I need to ask him or her to make sure that I'm getting the right test?
Well, I would make sure they order a free T3. Say,
Free
will
T3.
you order a FREE, free T3?
Okay.
If they won't order the test, ask them why they will not order the test. If they refuse to order the test, then my advice is to walk out of that office because they're not going to get the right test. If they agree to get it, then ask them if they know the proper range, and they don't because they're not taught that. They need to understand that your range is actually higher than the noted normal range on the lab studies.
Because the normal range is really skewed.
The normal range is far too low because there's such a large population of hypothyroid patients. They take it from a cross-section of the population. And if you've got a majority of the population, 60%, that are hypothyroid, that's going to throw the ranges off.
So the ranges are wrong to begin with.
The ranges are wrong to begin with, yes. They're far too low. You take a person at 230, which the labs say are normal. That person can't get enough sleep, doesn't want to get out of bed. Their skin's dry, they're losing their hair, they're depressed, they have high cholesterol and high hypertension, but yet their doctor won't treat them because their lab's normal.
So Dr. Knott, once you diagnose a patient and start prescribing these hormones, what are some of the results that you see? And how soon can someone see results?
Well, you know, I've had patients from all walks of life, and various patients report different things. But most of these patients seem to get their life back. You know, where they didn't have energy before, they now have energy. Where they were depressed before, they can get off their antidepressants. The people who have high cholesterol, their cholesterol goes down. The people who have hypertension, their blood pressure goes down. I see all these changes. The changes can start happening in as little as a week. Sometimes 3 to 6 months is necessary to really see the full-fledged results of this treatment.
So Dr. Knott, if I'm a patient who is curious about all of this and I can't fly to Atlanta to come to your office, you've actually given a resource to people all over the country on your website.
Yes. Well, it's a work in progress. But right now, probably the best way for someone to find a doctor in other parts of the country is called the Broda Barnes Foundation. He was an endocrinologist in the 80s and way ahead of his time. Wrote the book called Hypothyroidism, the Unsuspected Illness. And he predicted the present epidemic that we're in. So the foundation is set up to give patients or prospective patients the names and addresses of physicians all over the country.